The aim of this video is to give you more information about a specific type of radiotherapy treatment for certain types of gynecological cancer in the Northern Radiotherapy Network. This is called brachytherapy. Brachytherapy is a highly specialised treatment and is not available in all of our centres. If you require this treatment, you will be referred to the Northern Centre for Cancer Care at Newcastle or the James Cook University Hospital in Middlesbrough, and you will be looked after by a team of brachytherapy specialists. The information in the video covers what is involved in brachytherapy, including aims and side effects, as well as the benefits and risks of alternative treatments, including no treatment. It will help you decide whether you wish to go ahead with the treatment, and you will have the opportunity to discuss any questions or concerns with your clinician.
For certain women who've had surgery for endometrial cancer, we use brachytherapy as an adjuvant treatment to reduce the risk of recurrence. So brachytherapy is internal radiotherapy, which is delivered, through a radioactive source straight to the tumour. And sometimes that might be on its own, and sometimes that might be after external radiation as well. We also see you in a review clinic. We'll see how you're doing, address any side effects, support you through that treatment, and then we discuss the brachytherapy side of things in more detail.
Brachytherapy, or internal radiation therapy, puts a source of radiation in or near the cancer or close to where the tumour has been removed following surgery. It's a local treatment and only treats a very specific part of your body. It may be given to you following a course of external beam radiotherapy or on its own. For patients with endometrial cancer, you will receive brachytherapy as an outpatient, which means you won't be required to stay in hospital.
So we'll look at everything, in detail, the type of operation that was done, what were the findings at the time of surgery to determine which patients would benefit from further treatment. And that's more of an outpatient procedure. So again, you'll have some measurements done in clinic where we do an internal examination and try with the size of the applicator that we need, because everybody is very different. And you have an idea on that day of how it will feel like, on the treatment day as well. So it's usually very well tolerated. Again, we've had patient feedback about how well they've tolerated the treatment. And because, again, it's very targeted treatment, if we're using brachytherapy on its own, generally the side effect profile is really, really good in the short and longer term. For the outpatient brachytherapy procedure, you'll come in, we'll place the applicator in. That's an all outpatient procedure with plenty of jelly on, so that goes in through the vagina and goes to the top of the vagina and secured in place. Once that's secured in place, you have a very quick scan so that we can make sure that the applicator is in the right position, and then that's connected to a machine. So the machine really just looks like this rectangular box, and it's got the radioactive source in. The radioactive source will then go straight through to the applicator, the top of the vagina, which is where we're treating, and then back to the machine again. And the whole thing takes about 20 minutes or so. It's actually the preparation for the treatment that takes the longest. So, you'd be here for about an hour, a bit more, but the actual treatment, 20 minutes on the couch. And again, you won't see anything, you don't feel anything at the time of the treatment. And once, the treatment's done, the source is back in the machine, then the applicator is removed.
Side effects of radiotherapy for gynecological cancer usually build up slowly after you start your treatment. They may continue to get worse after treatment finishes, and then they will gradually improve over the next few weeks. Your radiotherapy team will explain what to expect and how to manage any side effects. Please view our video on side effects for gynecological cancer for more detailed information.
We absolutely understand that it's a very difficult, emotional time for women undergoing treatment for the gynecological cancers. And often what I tend to see is actually when you're having the treatment, you're just focusing on getting through a day at a time, and it can often hit you at the time when you finish the treatment, and suddenly, you have a lot of time on your hands to think about your diagnosis, to think about what's happened. And what we would say is, please pick up the phone, please reach out to us, and we can organise counselling, we can organise clinical psychology support to help you through that.
Following your treatment, your health professional will talk about what happens next. You'll have ongoing follow-up with your healthcare team. We are aware that some patients may require extra support and help whilst visiting the department. If this is the case, please let us know either in advance or on the day of your visit, and we will assist with your needs in any way we can. If you are running late for your appointment, just let the department know and don't worry. We try our best to keep to appointment times, but delays do happen sometimes. If we are running late, we will let you know. Please visit the Northern Radiotherapy Network website if you have any questions or queries.